our accomplishment. So this is the updates on the COVID-19 vaccination rollout. If we can have the next slide, please. So as of August 2, nakaabot na po tayo ng 21 million jabs. These are first and second doses with a daily average job of 523,000 from the week of July 26 to August 1. And we recorded on July 27 the highest number of vaccine administered, 659,029. So we have a moving weekly accomplishment of 3.6 million. Sa ating mga priority groups, ang breakdown po sa ating A1, yung workers in frontline health service, may 97.4% po tayong partially vaccinated. So ito po yung ating first dose. Tapos yung fully vaccinated, yung ating 84.74% fully vaccinated. Pag sinabi po nating fully vaccinated, ito po yung nag-second dose, pag 2 dose ang jab, dun sa Janssen, J&J, isang dose po ay fully vaccinated na yan. So pinalitan po natin, imbes na first dose and second dose, partially vaccinated, tapos fully vaccinated. Tapos yung ating expanded A1 po ay nakikita nyo sa screen, 398,000 and 198,000 respectively. Sa ating A2, yung ating senior citizen, ay naka 34.97% na po tayo ng partially vaccinated at umabol po yung fully vaccinated 32.57%. Mostly accounted for yung pagbigay po natin yung ating J&J na 1 dose lang po. Yung sa with comorbidities, nasa 53.6% na tayo sa partially vaccinated at 48% tayo sa fully vaccinated. And then we have down the line, we are operating with 4,468 vaccination sites. And to date, there are 28 million doses vaccines deployed versus the 34,000 that have arrived. Next slide, please. In the next slide, we will see our accomplishments, how many vaccines were administered. Makita natin at the beginning, konti lang po yung ating mga bakuna, may donation, tapos una pong dumating yung mga donation ng China, tsaka donation ng COVAX facility. So at the beginning, we were able to jab in March 777,000. In April, nung dumami na po ng konti yung vaccine natin, especially with the arrival of AstraZeneca from COVAX, nag 1.1 million. In May, nag 3.3 million. Nung June, simula na pong dumating yung ating mga pinocure na vaccine, 5.3 million. In July, ito po yung madami-dami na po yung dumating na vaccine. So meron po tayong 9.9 million. For August 1 and 2, may 730,000 na tayo. So yun po, 21 million. Tapos nakikita nyo sa month of July, how fast we were jabbing 1.6 to 2.7 million every week. Kaya po tayo naka 9.9 million in July. And then in August, naka 730,000 po tayo. Next slide, please. So ito po yung number of vaccines administered from 26 July to August 1 para makita po natin na dahil po dumami na yung vaccine, especially yung one dose vaccine natin, tapos marami na pong gustong magpabakuna. We had a total of 3.6 million vaccines administered, and we had a daily doses of 659 on July 27, 648,000 on July 21, and 648 on July 30. Next slide, please. This will tell us what are the vaccines that have been delivered as of August 2. So, marami po tayong iba-ibang klase ng vaccine. Yung ating COVAX, these are donated vaccines. We have a total of 10.2 million doses comprised of AstraZeneca, Johnson & Johnson, the Janssen, and the Pfizer. Our our other donated vaccines are the Sinovac 1 million from the People's Republic of China. We have AstraZeneca from the government of Japan, and we have AstraZeneca from UK for 115,000 for a total of 2.5 million doses. Yung ating mga binili naman, we have 18.5 million na Sinovac, 500,000 po sa private sector, tapos 400,000 sa LGU. Meron na rin pong dumating yung binili ng AstraZeneca sa private sector na 1.1 million. Tapos po yung Moderna na 500,000. May Pfizer po, ito po yung binili ng national government na 938,340 doses. Tapos yung Sputnik V na 350,000 doses, component 1 and component 2 for a total of 21 million doses kasama ng ating 12,000 na donation. So a total of 34 million doses have arrived and many of them have been deployed up as of August 2. Ang hinihintay nating deliveries, which we will see in the next slide, so August, for the month of August, so yung AstraZeneca dadating po ngayon, yung Moderna ng COVAX, which is US donation, ngayon, yung AstraZeneca was yesterday. Then we are expecting a series of Sinovac during first week, second week, third week, and fourth week. Nandyan po yung mga quantities. On the week of August 9, we will have our next tranche of Pfizer. Ito po yung binili. Yung Sinovac is also procured. Then August 9 to 15, the AstraZeneca 1.1 million procured by the private sector. We will have a Chinese donation of Sinopharm of 1 million in the week of August 10. And then another tranche of Pfizer. No, we will determine the dates. But meron tayong isa o dalawa na dadating by August, and we have Moderna procured by the private sector. We have another 3 million incoming donation from COVAX. Hindi pa natin alam kung ano ito until we have the documents, and then we are negotiating for another 1.6 million for Sinovac to fill in our gaps for a total of 22.7 million expected deliveries for August 21. So what have we achieved? To compare, next slide please. Ang ating target po noon, by the end of July, total deliveries of at least 16 million. So we have had 16.4 million deliveries, administering 10 million doses of vaccine for July. We were at 9.7 million, and we targeted 300 to 400,000 jobs a day. We reached 523 jobs per day average. Highest is 627. For 7 million full doses and protection, we have achieved 9.1 million full doses protection. And we finished the second dose of healthcare workers by at least 90%. And you see our accomplishment there. In terms of August, our targets are 25 million doses delivery. So based on the earlier projection, we were looking at 22.7 million. So baka dagdagan pa ito so that we can have the 25 million doses delivered in August as target. With 3 million per week or 12 million jobs this August, we are hitting to almost 3 million. and sustaining an average daily jobs of 600 to 700,000 jobs supply per meeting. We have reached the 600 plus. And if we can achieve from 7 million full doses to double it to 15 million by end of August. And we will have full protection for our healthcare workers, including our expanded A1, which includes our new hires, etc. And we will administer 5 million to doses to A2, our priority senior citizen. Next slide, please. So what is in store for us under the ECQ? We were mandated by the IATF to ramp up vaccination even under ECQ. So we have provided this guideline for areas under ECQ. If we can stick to strict scheduling and pre-registration, walk-in shall not be allowed except for priority group A2 as far possible. So if we can do the scheduling and registration before they go in and job and prioritizing group A2 and group A3. But since our focus is really group A2 and A3 because they are the most at risk and the most vulnerable, pwede silang mag-walk-in, no? And we will have work schedules for our vaccination workforce because we want them to be able to observe minimum public health standards, protocols, and if they can work in a bubble-like atmosphere para para ma-minimize ang transmission. In terms of service delivery, our objective is to bring the vaccination services nearer to the vaccine recipients. So, iba-iba po yung ating mga strategies and we will leave it to the LGUs as individual LGUs or as group of LGUs. They can do quadrant or barangay zoning. They can continue to use their mobile vaccination buses. Meron na pong existing yan, like Quezon City and Taguig yata. And then we will deploy mobile vaccination teams para sila ang pupunta where there are more people that need to be vaccinated. And we will establish temporary vaccination sites. All vaccination sites must provide, continue to provide priority lanes. Dati na po natin ginagawa ito. And vaccination in medical centers and hospital shall be temporarily suspended in ECQ areas para po yung ating mga health worker na nag-a-attend sa ating COVID response sa ating mga pasyente ay hindi po mahila para sa vaccination. And then we will have a dedicated vaccination workforce para hindi po nagtatransmit ng mga illness. Next slide, please. And for transportation, we have encouraged our LGUs to provide transportation services both to the vaccine recipients and vaccination workforce, and their points of pick-up will be announced. Our mobility pass will be proof of vaccination schedule. With the ECQ, alam naman natin walang ibang pupuntahan yan kung hindi talaga sa opisina o kaya dito magpabakuna. And we would like to have dedicated human resource for health so we can have select dedicated human resources, as I have mentioned earlier, dedicated solely for vaccination. And just in case magkasakit, magkahawaan, kailangan mag-quarantine, and we have a contingency plan. We will provide PPEs and disinfectants. We cannot overemphasize minimum health standards in the workplace. And especially this time as we are prioritizing A2 and A3 and with the Delta variant looming, it's very important that we have a good health assessment and physical examination of our vaccine recipients. And in terms of delivery and distribution of vaccine, it will be 24/7. As far as distribution, the logistics team shall be categorized as authorized person outside of residence. And as I mentioned, if we can implement a workplace bubble to minimize transmission. So I think that's the last slide. Maraming salamat po.
So thank you, Yusek Mirna. With the presentation of Yusek Mirna, we saw how the NBOC is ensuring proper rollout of our national vaccination program through their guidance. So umulan man o umaraw, tuloy-tuloy ang ating pagbabakuna, especially dahil sa pagpursige ng ating mga LGU at vaccinator. So let's move on to the open forum. So may I remind our media partners to keep your questions concise and limited to the topic presented by Yusek Mirna. 2 questions lang po sana. So for the first question, let's have Aiko. Aiko.
Yes po, good morning po, Yusek. Good morning.
Morning.
Apo. Yusek, nakita po natin na hindi pa po ganun kadami yung pong nabakunahan sa ito sector, and of course with the implementation of ECQ po, paano po natin mararamp up pa po yun and strategies para mas lalo pong mahikayat sila with the threat of Delta variant? Salamat po.
Unang-una, kailangan yung information tapos advocacy na ang pinaka-importante sa ating Delta variant ay yung mga senior citizens. They are the most at risk and the most vulnerable. Kaya kailangan silang magbakuna. Alam naman natin na previously 65% of deaths are 60 and above, no? So sila po ang hospitalize, sila ang magkaka-serious illnesses. So kailangan pong mabakunahan sila para may protection, and then we do not overburden our healthcare system. So ang inaasahan po natin kayo lahat para hikayatin sila. Inaasahan din po natin yung ating mga barangay health workers. Kaya po ang ginawa natin, pwede pong mag-walk-in yung ating mga senior citizen, tapos priority po sila kung saan pwede. Tapos may mga benefits, yung ating mga nasa barangay po ay inatasan na mag-ramp up ng kailangan bakunahang A2. Thank you.
And follow up po, Yusek, hindi po kayo maapektuhan yung more than half or over 500,000 po natin na daily average dito sa implementation ng ECQ, because we've already reached the peak po na 600,000 plus nitong July 27. Hindi po kaya nakikita po natin yung assessment na bababa po yung daily average target po natin?
We are confident that the NCR mayors are very creative. Makikita nila kung paano nila paiibayuhin with proper scheduling yung kanilang mga bakuna. The main bulk of the 600 jobs per day are really coming from the NCR. But we are also now encouraging with more vaccines also given to our other regions, Region 3, Region 4A, 7-Eleven, and the others. Tataas din, tutulong din sila para ma-reach natin yung target nating 600 jobs. So kung sakaling may a little falling short ng NCR because of the ECQ that will be implemented, kailangan din mag-ramp up yung ibang rehiyon para sabay-sabay ho tayong makakamit ng higher coverages every day.
Thank you po, Yusek. Thank you, John.
Thank you, Aiko. For the next question, let's have Catherine. Catherine.
Good morning po, Yusek.
Good morning, Catherine.
Yes po. Ma'am, yung sa latest target lang po for the month for starting the vaccination for the general population, ano na po yung latest target natin kung kailan yun magsa-start? Kasi yung last or latest pronouncement before, I think that was April. Ang sabi po is it may start by August or September. So with the current pace po ng vaccination natin, ano na po yung target natin for the general population na vaccination?
Catherine, it will still be the same. Nakita niyo naman yung ating data, naka 30%, 35, magta-35% tayo sa senior, tapos mga 50 something sa comorbidities. Nandun pa to tayo sa A4, tapos may A5 bago tayo mag-general public. Pero siguro pagdating ng September, halos konti na rin yung general public kasi many of them are part of the poor, many of them are part of the A4. So konting-konti na lang ang hindi na include sa ating mga general population. These are the healthy 18 to 59 years old. supplies permitting. We would like to open the public. May mga nagsasabi nga bakit hindi bakunahan yung willing. Pwede ho sana yan kung anong tawag dyan, marami na tayong bakuna. As it is, no, ang target sana natin sa August, 25 million ang mai-deliver. Currently, we have 22 million. So may shortfall pa. So mag-strive pa rin, kaya may 25 million para yung kulang for that month, maghahanap pa rin kung saan pwedeng kuhanin. So baka September, October yung general public. Miss Catherine.
Okay po. Follow up, pag population po, anong estimate na total number ng babakuna for this month?
I don't have the exact number, but kung ang total ay 20 plus 15, target population 0.6 ang 17 plus 30, mga
Catherine, for next question, Greg.
alam po naman natin na part of the guideline is pwedeng mag-walk-in ang senior. Wala naman hong ibang pupuntahan ang senior kung hindi magbabakuna. They should not be going out. So we know that they should have the shortest route, and then i-clarify yung rota ba nila ay talagang papunta sa vaccination center. I'm sure there will be some honesty involved for our senior citizens to be honest that they're really going to our health centers for vaccination, and discerning naman tong ating mga pulis na talagang magpapabakuna itong mga senior citizen kasi wala namang ibang pupuntahan at naka-close naman tayo karamihan ng mga establishments, di ba?
Okay po. Ma'am, next question. The Vaccine Experts Panel has previously said that we will need to vaccinate 85% to 90% of the population to achieve herd immunity amid the threats of Delta variant. May we get your take po on this, and when do we think we could achieve this considering the pace of our vaccination po right now?
Yes, our initial target was 70%, no? That was based on the efficacy, tapos maraming mga mathematical models na ginawa ng ating mga experts, and also based on previous experience with other vaccines. But with the Delta variant, there is a looming proposal na kailangan taasan pa yung ating vaccination coverage to 80%. So that will mean include na natin yung below 18 years old kasi karamihan po ng 70 million na covered na siya ng 18 above. So kung mag 80% ka, ibig sabihin you will have immunization for those below 18 years old. Pinag-aaralan pa yan. We are cognizant of the fact that we really need to increase our targets, but we will need to look at our vaccine supply and also at the different efficacy of the different vaccines that will be considered. So initially, our best estimate was end of the year and beginning of next year, 70%. Kung mga 80%, baka alanganin, but this will help us and the vaccine SAR and our team really look for more vaccines to be able to reach that 80%. At best mga 50 to 60 ang given the current supplies, unless talagang i-move natin na the supplies come on time and we have all the paraphernalia. Hopefully end of the year, but best estimate, we will see mga, although for some focus areas like NCR, we're looking at September, October, na mas ma-achieve na nila yung 70. But if we will reach it to 80, then we will have to wait for our policies on the vaccination for below 18 years old. Thank you.
Ma'am, just a quick clarification. Yung possibility of vaccinating below 18, that would follow after the rest of the population, which is targeted to be at September or October?
Yes,
Alright.
they're studying that also. Our experts are not discounting the fact that we might need to give children below 18, baka 16 to 18, especially those with the comorbidities. But we look at the general trend. Many things are evolving and progressing as far as the vaccination is concerned. So as of the moment, yan ang iniisip. But based on the studies, baka pagsabayan. Depende din sa supply. So we don't need to wait for the pagkatapos yung general population bago yung children. They will look at the statistics. Sino ba ang nagkakasakit? Ano ba yung mga efficacy in children? Kailan ba babakunahan yung mga bata? We have an adolescent trial group that is ongoing para makita yung epekto din ng bakuna sa ating mga adolescents. So it will all come from studies abroad and our own studies kung kailan magbabakuna ng bata, and should we wait for the general population to be vaccinated before the adolescents at least are vaccinated. So in the next coming months, masasagot na yung ating mga katanungan na yan with more data coming in. Thank you.
Thank you, Yusek. Thank you, Zolo.
Thank you, Greg. For the next question, let's have Red.
Hi po, good morning,
Red.
Yusek. Hi po, good morning.
Good morning, Red.
Ayan, good morning po. First question, yun nga po, sabi niyo po September to October nga po yung general population. Pero sa Metro Manila mayors are wanting na i-vaccinate na po lahat ng general population. Medyo may conflict po. Nag-usap na po ba kayo ng Metro Manila mayors regarding their proposal po and your insistence na September to October po magsimula general population?
Ang ating ang premise natin ay supplies per meeting, no? So we will have to balance. We need to vaccinate our A2, A3, kaya tayo nag-prioritize because we do not have enough vaccines. While we have reserved 4 million for NCR, kailangan hanapin nila talaga yung most at risk at most vulnerable because they will burden our system. Ngayon, hindi naman ho pwedeng ibigay lahat sa NCR. While they are the focus areas, may mga surge areas din po tayo sa iba-ibang parte ng Pilipinas. And then we have other priority areas. Like what I was saying, many of the general population, nakasama naman na yan sa poor, or they are part of A4, or they are part of A1, A2, A3. Hindi lang naka-classify na sila pala ay may comorbidity, sila pala ay senior citizen. So mga ganon. Yes, supplies per meeting, they may be allowed, but for the current supplies available, baka hindi pa kayang lahat ay bakunahan sa general population.
And last question na lang po. Ito, pinasasalan po sa akin doon ng kaibigan ko. Meron ako nakita po sa social media na meron na raw parang ICV or International Certification for Vaccination for COVID-19 or yung sinasabi yung yellow card. And marami daw po nag-apply sa Bureau of Quarantine dito. Sabi nga raw, nagkakaubusan na nga raw ng slot sa mga Bureau of Quarantine centers eh. On the part of you, Yusek, is it advisable po ba na kumuha ng ganitong card, especially for international travel sa Bureau of Quarantine? Kasi, kasi mas gusto ng mga tao siguro na assured sila na if they're going to go international travel, baka mas tanggapin yung ICV card as opposed to sa regular quarantine card na ini-issue ng mga LGU. So, ano po ang say ng DOH ito? Kasi ang dahil po nag-a-apply po rito, and dahil mo na ito po to 300 pesos po yata nagkakaubusan na raw po ng slot sa Bureau of Quarantine. So, ano pong sasabi po niyo dito?
In terms of the ICV, not all the countries recognize the yellow card. Parang ito kasi yung yellow fever, no? Some countries like Tanzania request vaccination of yellow fever, and this is done by the Bureau of Quarantine. So kaya ko nalagay na yellow card, no? Some countries recognize the yellow card as a proof of vaccination. Hindi po lahat ng countries nagre-recognize ng yellow card as a proof of vaccination. We are ramping up our capabilities with the ICT and the BOQ para maka-generate po tayo ng digitized vaccination card. In many areas, yung regular na bakuna card na vaccination certificate na binibigay ng LGU, i-certify lang ng DOH, tinatanggap niyan. But in the next month, at the end of the month or beginning of September, sana maayos na natin yung ating digitized system with the ICT para automated na. Doon ka na kukuha ng ating vaccination certificate. May dalawang issue kasi yan. WHO is looking at nagiging discriminatory kasi pag if countries require a vaccination certificate. The vaccination certificate will just help the bearer reduce their quarantine procedures o kaya give them some privileges, but this should not be the reason for not admitting them in certain countries. So, pakihintay na lang po yung mga updates natin. ICB, yes, but it's not required for all countries. They upload, mag-search po sila sa mga countries kung saan sila pupunta para malaman kung ano yung mga requirements for vaccination cards.
So again, no need pa po na mag-apply ng yellow card right now kasi sabi nga po nagkakaubusan na raw po ng slot sa Bureau of Quarantine. So baka merong mga tao na baka misinform na baka kailangan yung yellow card.
Yes, we will have that in our comms that not all countries require the yellow card. Kung may mga balak po, hindi naman po pwedeng reserve, no? Pag may balak po kayong mag-abroad, tignan nyo po sa internet, i-google nyo po kung ano yung requirements. Baka ordinary card na may konting attestation, okay na yan. But by end of August, beginning of September, we hope we can already start automation, and we will now have the ICT issue the digitized vaccine certificate. Ang in charge din pa rin nito ay Bureau of Quarantine. Thank you.
Okay po. Salamat po, Yusek Mayor. Salamat doon.
Thank you, Red. For the next question, let's have Caroline. Caroline.
Ay, hello po, Yusek. Good morning.
Yes, Caroline.
Hi, ma'am. Ma'am, my first question lang po. Bakit po hanggang ngayon mababa pa rin yung vaccination rate sa persons with comorbidities and senior citizens, despite the fact that we have been vaccinating them since, I think, last part of April or early May? And saang regions po mababa yung vaccination rate nila? Is it because of limited supply pa rin po ba?
Initially, the problem for many of the other regions were limited supply kaya hindi sila na-vaccinate ng A2, A3. Even with NCR, nasa 62% nga sila ngayon. They have not really ramped up their A2, A3. Ano ba ang problema ng, first let's go to A3, comorbidities. Kasi meron pag-iisip nung una, may sakit ako, bawal ang bakuna. Kaya kailangan natin ulit-uliting sabihin, kung may sakit kayo, may comorbidities, lalo po kayo kailangan magpabakuna kasi pag nagkasakit kayo ng COVID, you may not die of COVID, but the complications from your comorbidities. Meron naman pong mga certification yung mga attending physician kung pwede nang magbakuna, especially with the comorbids. Ang gagawin natin ngayon, mag-special hubs tayo para yung mga special groups, yung mga HIV, yung may mga cancer, ay bakunahan sa special areas para hindi sila makisalamuha sa ibang mga areas. Doon sa A2 naman, syempre yung ating mga senior citizen, alam natin hindi tech-savvy, ayaw mag-register, o kaya nahihirapang mag-register. Tapos may mga pag-iisip yung ating mga senior citizen dati, matanda na ako, mamamatay na ako, why don't I give my slot to another younger member of my family, without realizing that they will be burdened to the family and burdened to the system if they do not get vaccinated and they get sick. So kailangan talagang more advocacy sa mga senior na kailangan, sabi nga nila nasa bahay lang sila. Bakit kailangan pa silang magbakuna? Kasi nga yung mga members ng family who go out and then come to their homes, sila ang makaka-infect sa mga members of the family. So yes, meron tayong tinatawag na tutok A2 with various strategies, yung house to house, registration, nag-encourage, nagbabandilya, nag-announce na kailangan nang magbakuna yung mga A2 natin. Dapat ituloy-tuloy pa rin natin yan at pagtulong-tulong tayong makumbinsi itong mga senior citizens natin na magpabakuna. But at least from very low before, 1 out 26%, we are now at 35%. Ang maganda yung Janssen, no? J&J. Kaya prioritize natin ito sa A2 kasi isang dose lang yan. Hirap ka na nga magkumbinsi ng matandang magpabakuna. At least 1 dose lang sila. Then you do not need to convince them to come for the second dose. So we will be happy for all of you to help us convince more senior citizens to come for vaccination. Thank you.
Ma'am, just a clarification before I ask my next question. Ma'am, yung special hub, ito po ba you're going to put up like a separate facility or will it be like halimbawa sa Lung Center of the Philippines or sa NKTI since nandun po yung mga persons with comorbidity? Will
Yes. Something like that. Kasi yung mga HIV, may mga treatment hubs sila. So we're looking at establishing in San Lazaro vaccination for HIV patients. Tapos yung may mga cancer, saan ba sila pwedeng pumunta? For NCR, we are starting to do that. Tama ka. In NKTI, for instance, they had vaccination of the yung mga na-transplant, both the recipient and the donor. So they were able to, may society kasi yan, may association sila. So they were able to do some vaccination. Sa Lung Center naman, those with TB, yung OPD, ibig sabihin na hindi na sila infectious, can also be vaccinated at the Lung Center of the Philippines. So yung mga ganon na tinitingnan natin. Cancer, we will look for saan ba best, we are consulting with our cancer groups, saan ba best na pumunta silang magpabakuna. Although, meron tayong tinatawag na hubs. Yung mga hubs na ito, treatment hubs, saan sila kumukuha ng mga gamot, yung ating mga cancer patients, tapos saan pumupunta yung ating mga HIV/AIDS patients para kumuha ng gamot. So we are exploring the possibility na mag-special vaccination sites. Hindi naman kailangan araw-araw in these areas. Thank you.
Ma'am, may last question na lang po. Yun pong, ano po yung mga sinasabi na focus areas for vaccination? Alin po yun? And ma'am, kamusta po yung deployment ng vaccine doon per region po? Sorry. Ma'am, may I know po the vaccine deployment per region as well as the current vaccine coverage per region, especially in focused areas? Thank you po.
Ipipremise ko lang that our initial plan, yung national deployment and vaccination program was initially sectoral ang ating priority. So nag-A1 tayo, yung mga health workers, tapos ng A2 tayo kasi ito yung mga most at risk, tsaka A3 kasi they are the most at risk, the most vulnerable, no? So ayan ang sectoral, kaya tayo nagkaroon ng prioritization. This is also based on the WHO SAGE recommendations. And nung nag-search sa ibang area, started with NCR, tayo na maraming mga kaso, nagkaroon tayo ng geographic prioritization. So added to the sector, nag-prioritize tayo ng majority of the vaccines were given the NCR plus bubble noon, and then now to surge areas. Yung strategy ng ating vaccines are na focus and expand. We focus on the priority sectoral, we focus on the geographic kung saan may mga surges, no? So umpisa bigay ng marami CR sa June 7, June 11, tapos ating Calabarzon kasi malapit sila sa CR, tapos sila ang pinakamaraming population, and then the economic hubs. So majority of our vaccine, but ang yung ating Janssen, we gave almost at least 100,000 each, no, para mabunahan yung mga senior citizen A1, A2, A3, and pwedeng A5. In terms of regional coverage for our target 18 years old and above, ang naka-first dose na or partially covered, pinakamataas pa rin ang NCR at 47. Sumunod ang region, ayan, 16% ang region 11, and then ang 4A, 12% ang region 3. Lahat na ito ng 18 years old and above na target. And then we have 7 to, so halos magkakalapit na yan, Caraga, mga 11. Ang pinakamababa ay yung ating BARM. Initially, it was lack of vaccine, but we also gave them 150,000 doses na ngayon ng Janssen, and for the upcoming vaccines, they will also be given. So, yung focus areas natin NCR, they're able to deliver the vaccines. 3, 4A, 7 and 11 also are delivering the jobs that are required from them. Tapos susunod na po yung 6 with Iloilo na nagkakaroon tayo ng problema, and then Region 10. And then halos magkakalapit na yung kanilang mga first dose accomplishment. Thank you.
Okay po. Just to clarify, kasi po it seems like dun sa mga previous statements nyo rin kanina, parang ang laking bagay na we have Janssen.
Yes.
So, yes, ma'am. So, ma'am, ma'am, paano po, moving forward, ma'am, meron na po ba tayong initial negotiation with Janssen to actually provide us with more vaccines po? Last na po. Thank you.
Ang problema kasi yung supply, no? The Janssen was a donation from COVAX. So, we might want to request additional Janssen from COVAX. I do not know kung nasa horizon na they negotiated with J&J. But that will be considered. Ang priority talaga, di ba? In terms of efficiencies, mas maganda yung 1 dose. But then kahit maganda yung 1 dose, kung wala naman supply. So we need to negotiate.
Thank you po.
Thank you, Caroline. So for the last question, let's have Kat.
Good morning, Yusek. Ma'am,
Morning.
Ma'am, question ko lang po. Is there a conscious decision for the government to procure more vaccines na mas higher yung efficacies dahil po may Delta variant na tayo?
Yes, no. Yes, no. Yes, there is more conscious may tinatawag tayong second generation vaccines, no? Initially, what we want is on recommendation from the vaccine expert panel, ano na yung acceptable efficiency. So, based on that, based on health technology assessment, based on the assessment kaya nabigyan ng the vaccines that were coming are with the benefits outweighing the risk. But with this Delta variant, any kind of vaccine offers protection. You can ask the vaccine expert panel, but hindi lang conscious effort tayo to look at the efficacies of the vaccine. There's also conscious effort among the vaccine manufacturers themselves to improve the quality of the vaccines so that yung mga susunod na vaccine nila are able to address the variants of concerns issues, no? So both ways, the supplier and the government, but always we are limited by global shortage of supplies. Thank you.
Ma'am, my second question, hingi lang po sana kami ng more details about the rollout of the digitized vaccine certificate. Ano po ba magiging itsura nito? Will it be a QR code? Will it be an ID? Paano po siya i-release? Just more details about the program, ma'am.
Yes, in 1 or 2 weeks, in 2 or 3 weeks pala, there will be some updates. The DICT and the BOQ and our technical working group composed of the DFA, DILG, our private sector, and some of our partners are looking into it. So we will have how it's going to look in the next 2 to 3 weeks. We will have you will have an bird's eye view of what's going to be issued in terms of the digital vaccination certificate being processed by being developed by the DICT together with the DOH.
Ma'am, follow-up question lang. Will it be a requirement in establishments or saan po siya magiging required na gamitin? Will it be a travel pass as well?
Wala pang mga ganon, but we just want to provide persons with the vaccine certificate for basically travel requirements when they go abroad, so that mas madali tapos mas efficient and more standard yung ating vaccination certificates. Even other countries are now developing also their own systems based on certain international standards. Pag mag-travel ka, some of the airlines will require a vaccination certificate. Thank you.
So thank you, Kat. That's
Thank you
all
po,
that
ma'am.
we have for our questions po talaga.
Yusek, good morning po. Hi, si Cedric Castillo po from...
Closing message na lang po, Yusek Mirna. Sorry po talaga, we really have to cut na po kasi po may meeting rin po si Yusek Mirna.
Yes, I just left my meeting. Yes, maraming salamat. I'm very happy that you're all interested as usual to our vaccination rollout. We have reached our milestones. Hindi lang po sa hard work yan ng ating vaccine SAR and those who were making the vaccines enter. Nandito po yung ating mga government units that are making it possible, but we also owe it to you. No? Your enthusiasm, your advocacy, you're keeping high the interest on vaccination is keeping us also attain those very high milestones in vaccination. So salain niyo po lahat, get the job that is available. Kung Janssen, isa lang yan. But please make sure that you have the second dose for those who have already their first dose. But do not forget, kahit na po bakunada, especially ngayon sa Delta variant, continue to observe minimum public health standards, mag-mask pa rin, mag-face shield, maghugas, social distancing. Maraming salamat po sa inyong lahat.
Thank you, Yusek, and thank you to everyone who joined us in our media forum today. Yusek Berher will be at the spokes briefing at 12 o'clock, and tomorrow we'll also have our media forum. So kung may mga tanong po kayo, pwede rin po i-send sa ating Viber chat so we can try to answer them. Thank you.